Honorable Shri Arun Chaturvedi ji, one of the very bright, young, upcoming futuristic minister, Rajasthan, has already seen, and I'm sure for years you will see him working in the government. Other dignitaries in the dais, ladies and gentlemen, half of the audience I think I would be acquainted with because many of them are medical professionals or related to medicine. I think this is a great effort by the National Rural Health Mission and their team to integrate different services, to dissect, to analyze, and to bring solutions. Because health, as you know, despite India's great economic achievements, despite being India part of the BRIC nations, and now of course the Indian at the BRIC International Bank, but still health is the greatest predicament. We have issues, largely we actually encounter toxic combination of high cost, uneven quality, and uneven distribution. So we have challenges, we have resources, we have limitations, but we need to be innovative as per the need of the state of Rajasthan. Actually, there are two important things. One, that there is a dual burden. One of the non-communicable diseases with the lifestyle changing India is facing. The other is the rural health services. And of course, the same data now you find in the slums of the urban areas. So there has to be really something which is going to provide what is termed as universal health care. Because we have been listening to different slogans and different plans all across the world. But fortunately or unfortunately, things need still to be transformed. There is no doubt that state governments and the national government have done some wonderful job in bringing down IMR, MMR, and all those things, but still it's a long way to go. There is, of course, a need of combining the government with the private sector, because, and of course, e-governance, as many of the people have already expressed, would be the key in development apart from quality. Because unless you build quality, whatever the amount of human resource you develop, ultimately we know that there are a large number of engineering colleges which you have built up, which don't have enrollment now because the number of engineers has gone up. But still, what the Infosys people gave the data, that almost 45% of the engineers who are qualified from different institutions, they are unable to get an appropriate job. So actually quality with quantity would of course be very important. And actually while I was looking into the venue of today's conference, it is fabulous because it deals with infrastructure, it deals with public-private partnership, it deals with e-governance, and of course a lot of other ideas. And therefore I believe that it's one of the integrated programs which is likely to be evolved, and of course the solutions, not only simply the recommendations produced, but there must always be a plan of step-by solutions and bringing them in practice. I'm grateful to the organizers for calling me here.